Hey guys, Dr. Jordan Miller with Integrated Health Solutions, and for today's video, we're going to be discussing the couch stretch. Now, the couch stretch is a stretch for the muscles, otherwise known as the hip flexors or the quads, in that front portion of the hip that run kind of down the upper and outer portion of the front of your thigh here. Now, we call it the couch stretch because it's simply done next to something that you can stabilize, aka a couch or a chair, a bed, something that you can kind of hold on to make sure that you're not wobbling because you are going to be in a staggered stance like this. Now, this stretch is great for those of us that spend a lot of time seated. So if you work at a desk, if you are somebody who is in that kind of leaning and bending position a lot, you're closing down the angle of those hip muscles, which then overall decompresses a little bit of what you're able to do. So it's making a little bit more of a tension, a tightness or restriction into those muscles in the hip area. So what you're gonna do, the leg that you would like to stretch, so let's say you feel a lot of tightness in that right hip, that is going to be the knee that you want down on the ground. Now, if you want to put a pillow or a blanket or something underneath the knee to make sure that it's comfortable, totally fine. The other leg you're going to have elevated, so we want you in kind of a staggered stance with something either in front of you or off towards the sides to maintain your balance. Now this, typically thinking, in order to stretch this, you would kind of lean into that forward position to kind of open up that hip flexor. A lot of times what you're doing is you're actually stretching that opposite hamstring as opposed to actually getting a really good stretch on that front portion of the quad. So what you're gonna do, if you're imagining that your waistline and your hips are a very big bucket of water, right? The ideal goal, instead of dipping water out of that front side of the bucket, you want to try and open up to the point where you're dipping water out of the back side of the bucket. Now, what I don't want to see is a back extension where you're kind of leaning backwards trying to open up that angle here, because you will feel a little bit of a stretch because you're ultimately opening up that hip angle, but at what detriment? You're potentially increasing the usage of the lower back muscles, not what you want to do. So from a simple standpoint, instead of dropping the hips down into that anterior tilt or that flexed position, you want to posteriorly tilt and rock those hips backwards. Now, the second you get into that posterior tilt, you'll feel that really good stretch through here. Now, this is a static stretch, meaning you are not going to do this in repetitions, holding it for 2 or 3 seconds, relaxing, holding it, relaxing. You want to get into a good locked position where you feel that mild stretch and you maintain that 30, 45, maybe even 60 seconds or so to very slowly and gently elongate and stretch that muscle. So because you're holding that for a longer period of time, very low intensity, right? I don't want you to get into a really locked out position where you're grimacing and you're feeling it really, really hard, so you have to kind of relax after 5 seconds. Simply lock out, feel the stretch, maintain your balance, and hold. Now you can multitask. Do this while you're still working, while you're on the phone, eating lunch or dinner, while you're watching TV. It doesn't matter because you're not otherwise occupied. Just simply hold the stretch, continue for about 30 seconds or so, and then ultimately, when you need to switch, do the exact same thing, right? Bring the hips into that posterior tilt, feel the good stretch, stabilize, continue to hold for 30, 45, 60 seconds or so. This is a very easy one that you could do multiple times throughout the day to really open up that hip flexor and relieve a lot of the stress and tension that comes on that front side of the leg and maybe even causes some of your unknown knee pain as well. So try it out. Let us know below if you have any questions, comments, concerns. Go to the link in our bio to click and reserve your appointment with one of our doctors today. See you next time, guys.